My name is, thank you. My name is Jillian Hopewell. I'm with the Migrant Clinicians Network, and we are an organization. You'll find out more about us down the road, but we're located in a number of places across the United States, and I am located in our office in Chico, California. So just to remind you, the webinar will be an hour, and if you have any technical issues, please put a chat. The session is being recorded, and you'll receive an email at the conclusion of the webinar with a copy of the presentation and an evaluation link. It is also an accredited webinar for nurses if you are a nurse and want to receive accreditation. So in order to receive accreditation as a nurse, you do need to complete the evaluation. We are also happy to send certificates of attendance to anybody who wants to receive that. So you can let us know when you fill out the evaluation. Just for Zoom housekeeping, just to let you know, everyone's placed on mute. If we highly encourage interactivity. So if you, a number of you are using the chat box, which is fantastic, and then the Q&A. We're all very well versed in all of this at this point in our lives. You can also raise your hand to engage in the discussion if you'd like, and we can, Gladys or Alexis or I will call on you on that. So to give you a little information about the Farmworker Health Network, for those of you who are not familiar with us, we are a network of 6 organizations that are funded by HRSA, by the Health Resources and Services Administration, to provide training and technical assistance to federally funded health centers, federally qualified health centers, and others who are providing care to agricultural workers. Each one of our organizations has a different focus, and we one of the ideas behind the Ag Worker 102, because we also do an Ag Worker 101, which is a broader overview of farm worker health in general. In this one, in farm worker in Agricultural Worker Health 102, one of the ideas is to go a little bit more in depth into the resources that are available to you. So we'll be going into more depth on what we provide to all of you a little bit further along. So I'm going to provide you an overview. We're still going to do an overview of agricultural worker health and safety concerns. If you want to go into further depth in some of those issues, then we do highly encourage you to look at recordings of the Agriculture 101. Excuse me. And then Gladys is going to talk about service delivery innovations that have been proven to be really effective in a number of different places. And we're going to also then go into resources for health centers on addressing issues for agricultural workers. Okay, so really we feel very strongly that in order to understand the challenges that face agricultural workers today, you really do need to understand the background, because there's a very unique history to agricultural workers in this country, in the United States, and then also to the efforts of a number of different people to really address health and social service concerns for agricultural workers. So there were the Migrant Health Program, which is a component of the federally funded health center system, was kind of a forerunner to a lot of the community health center movement, and has been kind of a critical driving force to some of the work that's been done. So prior to, but then sort of going back a little bit earlier and thinking about how agricultural work has evolved in this country, we really evolved from a country where there were a lot of small farms to, and not just in this country but across the world, where advances in agricultural production, the technology behind it, increased the demand for a migratory or a seasonal labor force. In 1917 that's when the United States really started thinking more about its boundaries and looking at immigration. Some of that happened prior to 1917, but the Immigration and Nationality Act of 1917 restricted people coming in. Then in the 30s, of course, there's the Dust Bowl and the start of domestic migration. And you looked at people coming from Oklahoma and other places to places like California to pick crops. In 1937, the Farm Security Administration was established. And then in 1942, during the World War II, there was a deliberate recruitment and employment of Mexican citizens during World War II. And so for those of you who are not familiar, it was essentially, we're going to talk a little bit about the H2A program, but it was a way to legally bring in lower cost labor from Mexico with the idea that they would be working temporarily and then returning to their country of origin. And then in the 1950s, the Public Health Service established the Migrant Health Unit. This in 1960, I don't know if anyone has actually seen this, but it's really useful to go back and take a look at, partly because some of the issues remain the same, unfortunately. But in 1960, Edward Morrow put out a documentary called Harvest of Shame. And it was about exploitation of the agricultural worker labor population. And it aired on Thanksgiving Day deliberately because they wanted to link it to food production. And since Thanksgiving is so, centered around food and coming together as a family. The Harvest of Shame had a very significant impact and was part of what led sort of that the public attention being paid to those issues was a significant driver for the Migrant Health Act, which was signed into law in 1962, when that really started the Migrant Health Program. And in 1970, there was a reauthorization of the Migrant Health Act, and then it also created the National Advisory Council on Migrant Health and added seasonal workers, which is an important point. So, those of you that work with agricultural workers know that while there are some that may migrate, there are many that work and stay in one location and don't necessarily move, but they have many of the same concerns. So since the 1970s, looking at a timeline of some legislative action and then thinking about where that leads us now, again, 62 was the Migrant Health Act, and that led to federally funded migrant health centers. 75 was the Public Health Service Act. And then we're going to talk a little bit about, a fair amount actually, about agricultural workers, about regulatory protections, and where farm workers sort of live within the world of regulatory protection. But there were some basic labor protections that came about in 1983. And this is all, really relatively recent history. In 92 was the Worker Protection Standard, which then that was related particularly to pesticide exposure and set some standards for what is allowable. In 96, the Health Center Consolidation Act, which then consolidated, it used to be that there was funding, for those of you who are familiar with federally funded health centers, there was the funding streams were a little bit more siloed, and this consolidated it under one. And then in 2009, there was funding that came through for the Community Health Center program. And then the ACA was enacted in 2010, which of course had a big impact. And then the ACA was fully implemented in 2014. Oh, and we missed 1987, which was the field standards, sanitation standards. Somehow we have to fix this. Our animation is all off, but the field sanitation standard in 87, that's also a really critical thing. And for those of you who work directly with agricultural workers, know that employers are required to provide potable water, toilets, and hand washing facilities in the field, which is obviously a very important and critical issue. So I want to talk about farmworker exceptionalism, because this is a really critical issue. And a major reason why there continue to be some, a number of issues for farm workers in in the occupational issues. So because of sort of the historical nature of some of the way that agriculture has developed in this country, basically, when labor regulations were put out, farm workers were sometimes left out of those. So for instance, the Fair Labor Standards Act left out farm workers. And so that left out child labor protections as well as overtime protections. And I don't know if any of you have seen, there are some states that are now pushing for overtime for farm workers, because that to date has not existed. And the child labor protections, I'm going to actually ask Alexis to come on because I want to make sure that I get the child labor correct. So if you, Alexis, can jump on with the child labor standard as it exists now.
So anyone who is, so in agriculture, you can legally work as young as 12 in the fields.
And the reason for that, historically, at least the stated reason for it, is because of family farms and the desire to protect the ability of family farmers to have their children working in the field. But what that has led to is, in certain cases, and there's really no accurate national data, but it has led to there being children as young as 12 working in the fields who are field workers and not members of the family. Workers' compensation and minimum wage. Also, farm workers are left out of some of those regulations. And then OSHA standards to protect farm workers. There's the field sanitation standard, which we talked about, but that only applies to farms with 11 workers or those farms that provide housing. And so that actually leaves out a significant number of leaves out the smaller farms. And then there are also fewer OSHA protections than you would have in other industries. And so this continues to be an issue that impacts farm workers and farm worker health. Yes, and Alexis has put into the chat, Farmworker Justice has this really fantastic interactive map where it looks at workers' compensation, overtime, and wage laws by state, because it varies quite a bit. So there's some states that have done a lot to protect farm workers, and there are others where they really are left very open to exploitation and to exposures. So again, just now getting into sort of health issues, and just to remind all of you that we do go into a lot more depth on health issues in Farmworker Health 101, and there's a recording of that webinar, which we'll share with you the link. But I think, what I always like to emphasize is that when you think about the physical health issues, so whether that's chronic illness such as diabetes or heart disease or infectious disease, I mean, any sort of physical ailment, what agricultural workers are dealing with, and the people who serve them, are many of the same issues. So it is going to be those issues: heart disease, diabetes, cancer. But you have to do the overlay of both mobility, living conditions, and then occupation particularly. And so as a Farmworker Health Network, as a group, one of the things that we really try and emphasize in working with health centers and others who provide services is this, particularly the notion of occupation, and using occupation as a social determinant of health, so that just asking someone what they do for work can be really critical. If you have a patient in front of you who has a headache, is that patient, do they have a headache because they have a migraine, or do they have a headache because they were potentially exposed to pesticides, or perhaps both? So understanding where someone works and the exposures that they're dealing with is really critical in understanding the healthcare and the health needs of this population. And it also, one of the other major overlying issues is then the management of health concerns. And that that is, so you look at something like diabetes, cancer, hypertension, all of these, whether it's an infectious disease or a chronic disease, is that person going to be moving for the purposes of work? Does that person have access to healthy foods? I mean, all of the kind of social determinants of health that you would pay attention to, hopefully, in all of your patients, you do need to overlay that with a couple additional questions, and that's occupation and mobility, and then also the living conditions, which is one that really impacts everybody. But understanding where an agricultural worker may be living is also critical to their health needs. We wanted to bring up COVID because this has been a really interesting phenomena, and hopefully one that yields some additional attention to the health needs of agricultural workers. And I don't know how many of you recall, but at the beginning of the pandemic, which seems like it was so long ago, but 2 years ago, I guess, agricultural workers were deemed to be essential workers because of the need for food. And if agricultural workers aren't working, then clearly we've got food supply issues. So they continued to work through the pandemic, and that included, being on buses that transported them from where they worked to their place of place of work, to where they lived to their place of work, and being around one another. So they were considered essential. They were kind of elevated in the minds of the general population of the United States as this critical workforce. But I think in talking to farm worker groups, a number of people felt like that wasn't accompanied with action that demonstrated how important they were. So that it wasn't accompanied with significant protections and looking at wages and other things. So as a group, the Farmworker Health Network, that's one of the things that we talk about is, with the increased visibility of the farm worker population during COVID, does this help us to think about ways to advance care for farm workers and support, and both sort of social support and financial support. In general, things that we've struggled with is misinformation, which is a struggle everywhere with COVID, but there are some unique aspects to it in the farm worker community. And initially, at least, it was difficult to follow the CDC recommendations of social distancing and hand washing, just by the ways that the work is set up, and the overcrowding that occurs on buses and housing and in packing plants and all of that. And then additional challenges related to working in living conditions. And we also have a number of all of the Farmworker Health Network organizations have some really great webinars in which we pulled in people from the, working on the front line to talk about changes that they made, adaptations that they made during COVID in order to provide really great care, or to provide the care that they needed to for farm workers with COVID. And then just finally, the limited or no personal protective equipment, at least initially, and then access to testing, treatment, and vaccinations. There's been a lot of work that's been done in these areas, but it's still lacking in some areas. The other really critical thing to pay attention to when you're working with this population are contributing factors to mental health challenges that people may have. And again, you're looking at mental health challenges that may be facing the general population that can be exacerbated by the circumstances under which farm workers may be living and working. And things to pay attention to are, thinking about separation from families, particularly for people who are migrating from other countries to work in the United States. Feelings of isolation, discrimination, and that's an issue. Discrimination and stigma are issues that really were exacerbated in recent years due to the political environment. So that is often a significant concern for people who are providing services, which then leads into fear due to immigration status. And then, of course, COVID-19 created for the entire country, really, these feelings of anxiety and isolation. Thinking also about illnesses related to substandard housing, things that may not occur to everybody who's, if, like you're just standardly, if you're a clinician or you're seeing someone in the field, things that may not occur to you on a regular basis, but you should sort of put in your sort of the things that you may think about when you're working with someone who worked in agriculture, is the potential for gastrointestinal diseases, depending on the quality of water that's available for people. Infectious diseases that may be unique, things like Chagas, things that may be in people's country of origin that may come with them, or there also is, with crowded housing and that sort of thing, there may be an increased risk of a spread of infectious disease. And intestinal parasites, conjunctivitis because of exposure to just occupational exposure, and then potentially lead poisoning because of substandard housing. And then work-related health risks. I'm sure a number of you could come up with your own list, but I think, pesticide exposure, we'll talk about that a little bit more, is clearly a critical issue. If you talk to people who, and those, I'm sure there's a number of you on today who work with agricultural workers, muscular skeletal injuries is probably the highest, that's probably the highest number or highest complaint that people, reason that people come to care. And you can see why. I mean, it's repetitive work. It's, it can be dangerous work, and all of that can contribute to musculoskeletal injuries. Heat stress, which is, we talk about a lot, and we're heading into the summer months and things are getting hotter. So that heat stress is a critical issue. Farm equipment, transportation to and from work. There's issues with lacerations, slips, trips, and falls, eye injuries, and then in some cases, insect, rodent, and snake bites. Something to pay attention to as people are working out in the field. So specifically related to occupational safety and health protection, we talked about the field sanitation standard, which is the one that was done in 1987, that requires potable drinking water, toilets, and hand washing facilities. Just as a reminder, that does not apply to farms with less than 11 employees. We do have, and there's a link here in these slides, but we have a clinician's guide to the field sanitation standard that was a joint publication between the Migrant Clinicians Network and Farmworker Justice. The worker protection standard, it was promulgated first in 1992 and then finally updated again in 2015. It was quite a struggle to get it updated, but we did, and that requires that's through the EPA. So that's the other issue, not to get too in the weeds about the regulatory and policy world of farm workers, but it gets complicated because some regulations are through OSHA and then there are other regulations that come through EPA. The worker protection standard requires employers to comply with minimum safety precautions when using pesticides on farms and in nurseries, greenhouses, and forests. And we also have a clinician's guide to the worker protection standard if you're interested in that. And then California and Oregon, thank you. I saw Jean had a question about addressing health risks for people who fight forest fires, which is a huge, obviously a huge concern. And it is a migratory labor force. California and Oregon do have a wildfire standard in place now. And then California, Oregon, Colorado, Washington, and Maryland have a heat standard in place. The wildfire standard does address health issues. Alexis, I don't know if you want to address that if you know more about the details of it.
About the heat standard.
No, about the wildfire standard.
So, there are currently efforts underway to try to standardize wildfire and heat protections across the Western states, across California, Oregon, Washington. Today, Washington issued emergency protections for wildfire smoke. And so those are now in place, and they're looking to make more permanent rules, also strengthening their heat exposure rules as well. But only a handful of states actually have a heat standard. Currently, federal OSHA is they started the rulemaking process to create a federal heat standard. That began in the fall. They issued what's called an advance notice of proposed rulemaking, and there are a number of steps that are taken in order for a rule to actually become promulgated. So they're currently at the first step. It's likely that a federal heat standard won't be, it certainly won't happen this year, hopefully next year, but it is a long process. But there are opportunities to comment. Federal OSHA has not yet put forth an actual proposed rule. The advance notice was more questions to stakeholders, kind of asking about kind of what should be in a rule, what should be considered. And so hopefully a proposed rule will be issued shortly.
As you can see, Alexis is the go-to person for policy and regulatory issues. So when we get to Farmworker Justice, just know that she's a great resource for all of you. And we are going to be sharing the slides. I'm not going to go into detail on these. These are some other labor and health protections. A couple, just a reminder that Farmworker Justice has this really great interactive map, so you can look and see what the regulations are in your state, because they're the coverage for workers' compensation and some of the labor laws varies very much by state. And now we're going to move to service delivery innovation. So my colleague Gladys is going to take over from here.
Thank you, Jillian. So yes, now that you have learned a little bit more about the unique challenges that impact this vulnerable population, we're going to discuss a few strategies and ways that you can maybe mitigate some of those barriers when providing services. So one area that really impacts agricultural workers is continuity of care. And this is in large part due to the consistent mobility that a lot of migratory workers really do. Given the nature of migratory work, they travel from one location to another. And so it's very difficult for them to establish a permanent medical home. So in reaching this population, it's one consideration for you to keep in mind that you might need to potentially collaborate with other providers in different states, or even provide medical records to this population, because again, they move frequently and have and habitate different areas of the country. Another thing that affects continuity of care is that agricultural workers also may not necessarily seek care. They might do so in urgent situations or in emergency situations. And this is in large part due because of some of the social determinants of health that they already face. A large number of this population doesn't have insurance. They also, as I mentioned, often travel and don't have a permanent medical home. And so it's very difficult for them to seek services. Another part is due to financial challenges, because a lot of agricultural workers have finances at or below federal poverty level. And so the strain of being able to afford services can be difficult for this population. If you go back to the previous slide, Jillian, I do want to mention another area is culture and language. So farm workers are very diverse and they have different language needs. So although Spanish is predominantly the language more commonly used in this population, a number of farm workers from indigenous communities and Latin America is actually growing in the United States. So this adds to the need of different indigenous languages and dialects. So that can make service delivery difficult given a limited number of multilingual providers and interpretation services available for this community. So it's very important to keep that in mind as you establish your language access programs and you provide training and continuing education for staff so they're aware of how to address this barrier and even utilize interpreters when needed. Next slide. So on the operational side, health centers are encouraged to integrate different methods that can actually help reach this population better. A couple of these methods are providing walk-in appointments to farm worker patients, offering extended evening or weekend hours. So again, given the nature of the work, agricultural workers often work through the evening or work long hours during the day, and that can limit their ability to take time off and go to an actual health center during a typical 9 to 5. So as you're providing services or trying to tailor programming to this population, you might want to consider having different hours of operation to reach them and maybe even offering hours during the weekends so that this population could have a better probability to access services. And now with the shortage of workforce, demand and capacity of health center can be a challenge in providing services as well. So it's important that as you're kind of re-engaging patients and being able to bring them back into services, that you have enough workforce capacity to meet their needs and can provide services to this population. Some other areas that pose challenges are transportation, particularly in rural communities, because again, that can be a barrier for farm workers. They may or may not always have transportation to go to healthcare appointments. So if you're providing services to this community, you may want to consider a different transportation options, or if you have the capacity to offer shuttle services or provide a bus pass or something like that, it would be helpful for this community in order to reach your health center. Now, in terms of costs, health centers operate much like a business, and they do need to remain competitive with the costs in the healthcare industry. So there's this added challenge of billing, given again, that this community may or may not always have insurance or the money to be able to pay for services. So being able to, offer different types of sliding fee scales is important to consider. And then also getting services, enabling services and outreach who are not always reimbursable, finding creative ways to be able to conduct these services without necessarily putting a strain on your budget or operating costs. So we're going to talk a little bit about some of the adaptations that are particular to mobility and culture. Again, as I mentioned, that some of these areas are things that farm workers will particularly benefit from, considering the diversity of the population and how frequently they move. So in terms of cultural adaptations, it's very important to consider the education levels, literacy levels, and cultural practices of your community. So when you're developing materials and creating content to be able to conduct outreach and provide information to this population, it's important to keep those things in mind so that you develop material that is culturally sensitive and appropriate to their language and literacy levels. You also want to keep in mind their different cultural health beliefs. If you wanted to incorporate some of those beliefs into your content or be able to have a way to connect with the population better, understanding their practices and customs is a very important thing to include in your patient education materials. So now in terms of mobility, a couple things that have worked for other health centers that particularly serve this community are portable medical records, and Jillian will actually talk a little bit about the bridge case management system that MCN offers when we describe each of our organizations. So having information that can easily transfer to another location if needed, being able to transmit health records to other health centers, especially those in rural areas, like I mentioned, because farm workers might not always be able to access that location. So it could be very critical to be able to connect with someone that is at least in their vicinity when they need services. So then in terms of other delivery models that have been effective is really utilizing promotoras de salud or community health workers to conduct outreach and be able to provide patient education materials to this community, collaborating with different organizations and partners like schools, work sites, faith-based organizations. And actually employers is very useful as well, because the more partnerships you create to build your resources and referral networks, the better able you are to mitigate some of the social determinants of health that particularly impact this population. So some additional concrete steps that health centers can really take to facilitate access to care are the following. Create a system to orient all patients to your scheduling practices. So if you are reaching the farm worker community, helping them understand when you're available, what days and times you offer, how they can come in for an appointment, and not assuming that they already know how to navigate the healthcare system, because like I mentioned, a large number of farm workers come from different countries, and so they might not necessarily be familiar with the system in the United States or even recognize how to go about making an appointment. So it's very important to recognize that some patients may not be familiar with scheduling or even the healthcare system in general. So finding ways to orient them and have them be more familiar with your particular services could be very useful. The next step would be to document the number of agricultural workers in your area, and so that you have a better idea of the population that is near you and available to serve. We at NCFH have a great tool that you can get some population estimation information to get a sense at least of the community in your area. We also offer migrant health action planning, so that you can develop kind of a profile of your patient that gives you an idea of their typical hours, the industry they work in, their background, education level, and all that, so that you get a better sense of the community that you're serving and can find ways to tailor services and even conduct outreach and provide information. The next one is we really do encourage health centers to be open and flexible so that they can reach the population. So having a scheduling that is not during your typical season, but maybe more tailored during the peak harvest times when the agricultural worker community is in your area, so that they can be seen quicker. And you know that if they're there from March through July, you really focus your efforts during that time and can offer flexibility in the services during the harvest season. And the last one is to just be accommodating when possible, be able to offer different work hours, being able to provide transportation options, and figure out ways to make access to care easier, especially because I mentioned, this population might not always come in for services right away or might not know where to seek healthcare support. So if you provide information and make it very easy and accessible, they're more likely to be able to engage in services. And we do think it's worth highlighting that the key role to partnerships is to be able to increase access to care for farm workers, right? So as you're looking at the different potential barriers that impact their ability to obtain services, you can potentially find collaborations to mitigate those barriers. So we, encourage you to look at who in your community are organizations, employers, like I mentioned, schools, faith-based organizations that you can collaborate with to really maximize the resources available and not necessarily do the double work. So it really does prevent duplication of services and expands the network of resources available for you and the farm worker community. One example of a successful collaboration that really utilizes partnerships is the voucher program model. And this is typically used when a health center may not have too many farm workers to serve or has a short season. And because of this, it's difficult for them to justify a specific migrant health program funds, or they don't have specific funds. So they instead refer to community-based organizations in order to meet the patient needs. So voucher programs really focus on outreach and case management services. They also provide patient vouchers to cover costs for services and are often utilize a referral basis to connect the patient to another community provider. It just kind of depends on the health center itself and the type of relationship they've established with that partner so that they can provide that referral service directly to the patient. So now with that, we are going to give you a quick overview of the different resources that we within the Farmworker Health Network have and that you can access to be able to mitigate some of the challenges and barriers when you're providing services to the farm worker community.
Thanks, Gladys. As Jillian mentioned at the beginning, this webinar is hosted by the Farmworker Health Network. So the Farmworker Health Network consists of 6 national organizations. We receive funding from HRSA to provide training and technical assistance to health centers that serve agricultural workers and their families. And so the 6 organizations, as mentioned earlier, are Health Outreach Partners, National Center for Farmworker Health, Farmworker Justice, Migrant Clinicians Network, Knack, and MHP Salud. So to give you more of an idea of the training and technical assistance we provide, we just want to share a little bit more about each of our organizations. And I will say, there are often questions of why are there so many organizations that are providing training and technical assistance to health centers serving farm workers? And the reason is that we all have our unique expertise and niche, and we all work together in various presentations and to create resources for health centers. We work collaboratively, kind of bringing together our different perspectives and expertise to provide training and technical assistance, but each organization does have its own niche. So I'm going to first talk about Farmworker Justice, which is the organization I represent. Farmworker Justice, we are based in Washington, D.C., and our mission is to empower farm workers and their families to improve their living and working conditions, immigration status, health, occupational safety, and access to justice. We really think about our work in a multifaceted approach. So we certainly engage in training and technical assistance in a lot of different ways, do public education and community organizing, training of trainers, but then we also engage in litigation as well as advocacy. And that's why when Jillian mentioned earlier about the policy, Farmworker Justice, we do a lot of work around policy advocacy. And we also share that information with all of you because it's really important that health centers and others serving farm workers understand how these various policies, occupational safety and health, healthcare, the labor policies, how these different policies impact farm workers and their access to healthcare. So if you want to go to the next slide, this is our website, and really our training and technical assistance focuses on a few specific areas. One being providing that information about policy and its impact on farm workers and their access to healthcare. Another is that we have strong relationships with legal services organizations, community-based organizations. And so we really try to encourage workers to connect to health centers if they haven't connected already, and really trying to build those partnerships across the community so farm workers in the community have a no wrong door approach. And so if they go to the health center, they know about legal services and Migrant Seasonal Head Start. And if they go to Migrant Seasonal Head Start or legal services, they know about the health center. So we really encourage you to go to our website and to check out all of our materials. We have materials for workers, materials for staff and others. So we certainly encourage you, and it is farmworkerjustice.org. And then the next organization is Health Outreach Partners. And I know Liam from Health Outreach Partners is currently on the webinar. So Liam, we are going to unmute you, and hopefully you'll be able to share more information about HOP.
All right. Thanks, Alexis, and thanks to all three of you for doing this presentation. As the part of the Farmworker Health Network, we split up the way that we do these presentations. And so it's really great to be here and to be a listener and a participant. But I'd love to share about Health Outreach Partners. So we've been around since 1970, but really for the last, I believe it's about 21 years in this national training and technical assistance model. So similar to the other organizations mentioned, what we really focus on is all things related to outreach and enabling services. So we see ourselves as advocates for outreach, and we're really focused on access to care and building health equity through our services that we offer. So just like the other organizations, we mainly serve community health centers, primary care associations, but really we're open to serving anybody and working with anybody who's looking to build access to care and health equity in this country. And so you can see our website on the screen, and we have tons of resources available, lots of written and printed resources, as well as recorded webinars and that sort of thing. The one thing I'll highlight is some of the more recent topics that we've been focusing on include organizational self-care, also structural competency, or how we can look at the social determinants of health and take that a step further and look to the root causes of how some of those social inequities have come about due to larger structural forces. And speaking of social determinants of health, one that we focus on a lot is around transportation. So those are just a few topic areas that we focus on in some of our work.
So, hi everyone. So I represent the Migrant Clinicians Network. My name again is Jillian Hopewell, and we represent the clinical component of the team. Our mission is to create practical solutions at the intersection of vulnerability, migration, and health. And we consider ourselves to be a force for health justice. We have a number of resources, as do my colleagues. Ours are focused around, there's some patient education materials that we have. We work a lot with different groups within the clinical team. So, when we do that, our focus is really on providing kind of the clinical information that people on the team need. We have a number of different trainings. We have a lot. We've done a lot recently in the last couple of years, in particular, on support for providers, for frontline providers. So we have resources for you to share with your patients. We have clinical information for you in providing care for your patients, and then we also have resources for you for your own self-care and ways to advance sort of wellness and well-being for members of your team. So this is our website address here, migrantclinician.org. I wanted to focus in on one particular program. Gladys mentioned it when she talked about service delivery innovations. So one of our programs is called Health Network. We've been running this now for over 25 years. It's a bridge case management system. It is free to all of you. It is grant funded. And the idea behind it is working with mobile patients as they move anywhere, really anywhere in the world. We've worked with over 111 different countries as we are providing services, bridge case management services to patients. So it can be somebody with diabetes, it can be someone with tuberculosis, it could be someone who is pregnant. We're working with a lot of pregnant women, someone who has cancer. So anybody, and you call up our program, and my colleague Theresia Lyons put in the links, but you can enroll your patients and then we will transfer their records. But really the more critical component of it is providing them with the case management services. So making sure that when they get to wherever they're going to end up, whether they know ahead of time or not, when they get to where they end up, we will help them find services. And in some cases that's easy, in some cases that's hard. It depends on the actual individual case. But we have virtual case managers, and they are all bilingual and available to help all of you. So the links to that, like I said, are up there from Theresia, and I hope that you take advantage of it. Please follow up with any questions. And then Theresia also put our wellness, our well-being services in the chat as well. Thanks.
Hi, everyone. So my name is Monica Garcia with MHP Salud. I'm a program director with the organization. And we're very honored to be amongst this group of organizations doing amazing work for migrant and seasonal agriculture workers across the nation. And our main focus is the community health worker model. So we've been doing this work for over 35 years. We're a national nonprofit organization that implements and runs the community health worker program nationally. These programs basically provide peer health education. It increases access to health resources and brings community members closer together. So MHP Salud has extensive experience offering health organizations training and technical assistance on CHW programming, which is tailored to any specific needs. I'm going to share our website here on the chat. So this is a copy, this is a example of our website. We have an immense amount of a wonderful library of resources in regards to community health worker programs, community health worker outreach, resources, and training and technical assistance. So please feel free to reach out to me or to any, there's some emails that you can access through the website and ask us for more information on that. But anything regarding integrating community health workers in clinical settings, specifically as explained before, the community health worker model really works in doing outreach and connecting with the communities. And so please feel free to reach out to us. Thank you.
All right, thanks to our FHN colleagues that were able to jump on and talk a little bit about our organizations. I'm going to wrap us up by sharing a little bit about the National Association of Community Health Centers. Unfortunately, we couldn't have someone from Knack here to co-present with us, so I'll share a little bit about them before wrapping us up with my organization. So Knack represents the nation's network of over 1,400 FQHCs, and they serve over 30 million people through their sites. So they really tailor to the community health center network and focus their services on supporting these centers so that they can provide direct services to the patients in their communities. Next slide. And the mission of Knack, as it was founded in 1971, is to promote efficient, high quality, comprehensive healthcare that is accessible, culturally and linguistically competent, community directed, and patient centered for all. So we're very excited that Knack is a big part of the Farmworker Health Network, and they also helped co-launch one of the biggest initiatives, the Farmworker Access campaign, in collaboration with us at the National Center for Farmworker Health. So I'm Gladys Carrillo. I'm the Director of Program Services at NCFH, and we are a private nonprofit located in Buda, Texas. And our mission is to improve the health of farm worker families. And we do so by providing a number of different services. Some include population-specific data, workforce development, health education resources and program development. And our particular area of expertise is board governance, training, and program management. Next slide. So as I mentioned, a large part of our initiative and the areas that we focus on are supported and guided by the Ag Worker Access Campaign. This is a national initiative to be able to increase the number of migratory and seasonal agricultural workers and their families served by health centers across the country. So I would encourage you to join the campaign, help us to spread awareness about this vulnerable population and keep it at the forefront of migrant health with us. And here is just a quick snapshot of all the services that we provide at NCFH and the numerous resources that we have available. So similar to my colleagues, I do encourage you to check out our website and look up some of these resources, because we have some for patients, some for workforce, some for staff. It just kind of depends on your needs, but we have a large number of resources available that you can download and check out for free. NCFH also helps coordinate and host the agricultural worker forums. So there's 3 primary regional stream forums that happen every year. One is the East Coast, the other is the Midwest, which we particularly host, and the last one is the Western. And so we collaborate with our partners at North Carolina Community Health Center Association and Northwest Regional Primary Care to be able to host these stream forums so that we could provide continuing training and education to today's workforce. We also collaborate with Knack and help them during their National Conference on Agricultural Worker Health every year. And we want to finish up by noting HRSA as our primary funder, but also as a great resource as well. It has information about different health center requirements, has information about different program opportunities, and some of you actually might even be already working with HRSA and providing health center specific data and information. So it does have a lot of resources available on their website. So we do encourage you to use that as a resource as well. And aside from the Farmworker Health Network, we focus really on agricultural workers. We actually have a lot of other partners and fellow NTAPs that focus on other special and vulnerable populations. And so we do encourage you to check out some of their websites and resources. If you're working with other vulnerable populations that might need your support, you can see some of the NTAPs listed on this slide. And then on the next slide, we actually have other VIVIC funded NTAPs that also provide unique tailored services to specific special and vulnerable populations. And last but not least, we have the Health Center Resource Clearinghouse. So the Clearinghouse is a great one-stop shop. It has all information from all NTAPs here, and it does include resources, webinars, different information on various health topics. So if you're looking for one centralized location to be able to access any of our resources and to look up information from any of our NTAPs, the Health Center Resource Clearinghouse is a great way or place to visit. Okay, and with that, here's our contact information. And I actually see that we could probably update this slide, and we'll make sure to do that when we send out the PDF of the slides to everyone so that you have Jillian's information and Alexa's information. And I'm happy to also add our other colleagues from the FHN, Liam and Monica, in case any of you have questions that we could answer, and we'll take some now. I think we have a couple minutes, so if there is any that we could quickly address before we wrap up, we'd be happy to.
There was a question in the question and answer section about whether or not patients for our health network program, whether it needs to be a patient or a provider that does the enrollment. And so we do have to have a provider of record. So the provider does have to enroll the patient, but once that patient is enrolled and we have to have permission forms signed for HIPAA, then we can contact that patient directly. So we can take the provider out of that communication loop if they want to be, but they do have to enroll. Are there any other questions? You can just type them into the chat. I know we overwhelmed you with quite a bit of information. Well, we are a minute past the hour, so I think we can go ahead and
Yes, thanks everyone for joining in. Feel free to reach out to any of us for support, questions. We will make sure to follow up with slides with today's presentation, and we'll ensure that all of our contact information is included on those slides as well.
yeah, and the survey should pop up when we end this, but then we'll also send you a link to it in case you missed it. The evaluation. Thank you so much, everyone.